Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about the defense mechanism called minimization. Let's get started. Minimization is a defense mechanism where, in essence, the person is trying to reduce the emotional impact of an event or experience on themselves. Now, that sounds pretty tricky, so let me give you an example of minimization. My psychologist might ask me and say, so, how did you, what happened there? Tell me what actually happened between you and your partner. And I might say, oh, well, she was she was being kind of nasty and so on and so forth. And then the psychologist might say, oh, that must have been really hurtful. Not really, it's like, it doesn't really do much. I'm kind of used to being, people being nasty, and it doesn't have a big impact at all. In essence, I'm minimizing, I am making smaller a very impactful scenario and very impactful feelings that come along with that impactful scenario by making it look smaller than it actually was. Another example, I might ask a patient and say, all right, now that you're sitting here with me, what do you notice happens within you? They might go, I'm not really sure. I might go, all right, well, if you have a look, and they might go, oh, well, I am a tiny bit anxious. Now, there I am seeing a person almost exploding, right? Like their face is almost exploding. They're just barely holding on together. And they're kind of minimizing their anxiety, claiming that, yeah, they might be a little bit anxious, but that's about all they have. Then I might point out to them and say, you say that you have a little bit of anxiety, but if you keep looking at it, where do you notice that anxiety? And they might go, oh, well, there's a little bit of pressure here. There's a little bit of pressure in my stomach. There's a little bit of choking going on. And I might say, do you notice that you keep saying that it's a little bit here and a little bit there and a little bit so on? But it also seems at the same time that you're kind of feeling a lot of pressure. Is that right? This idea that you're kind of making it smaller or you're making it less, do you see that that could kind of be hurtful to you? That you would minimize what's going on for you? And they might go, yeah, I have a tendency to do that. For example, with my partner, he can be quite abusive, and I tend to just kind of go, oh, it's not really a big deal. And so if you don't do that here right now, if you don't kind of minimize your anxiety here right now, and we look at it again, no, I mean, actually, yeah, I'm really anxious right now, and I'm having thoughts that you're judging me. They start projecting, and I'm actually wanting to leave. So if you think about that, it's kind of like minimization can be about just about anything, any feeling, including anxiety and including the impact of scenarios and situations. So what you want to do as a patient, you want to help yourself not minimize yourself by acknowledging the reality and the actual impact of what that's been on you so that you can heal. And as a psychologist or a psychotherapist, counselor, social worker, whatever, you're going to want to help your patient actually realize the exact or the actual impact of that experience if they can handle it. And if they can handle it, comes back to a whole different conversation about a person's ability and structure and fragility and so on and so forth, which I think I have other videos there about. But this is on defense mechanism, so we'll keep it at that. Please do like the video if you liked it. If you never understood minimization before, but you understand it now, please give it a like. If you feel like you need another video on minimization, let me know and I'll pop another one up. Thank you very much, and I'll see you again next time.